Fox 61 Morning News begins now.
Still ahead for you this morning here on Good Day, Connecticut. Tackling depression. One local hospital is hosting events to help deal with mental health concerns. We're going to explain as the series gets set to begin. And don't forget to download our all new Fox 61 News app. It's free and it's in the App Store and Google Play right now.
The Bristol Hospital Counseling Center is hosting a free monthly mental health and substance recovery series starting on August 1st. The first discussion is on depression and is open to all those who are seeking help and want to take part in an open conversation on that subject. Here to discuss some of the signs and the symptoms of depression from the Bristol Hospital Counseling Center is licensed clinical social worker Michael Miarecki. Thank you so much for being with us.
Thank you for having me.
Let's start first and foremost. When we say depression, what do we mean? What is it?
So depression is a mental illness diagnosable through the DSM. Its symptoms include loss of appetite, not being able to sleep, loss of interest in things that one once used to have interest in, hopelessness, feelings of worthlessness, sometimes even suicidal ideation, thinking that they want to die.
Okay. It can really go from very different extremes.
Yeah, there's very different diagnoses for depression. It's an very umbrella term for, very, very sad, very, very deep depression for some people. So,
do we know what causes depression?
Depression can be caused, it could be a genetic link to depression. So if your parents were depressed, you could feel depression from that. You could be triggered by an event. So if you suffered a trauma at some point in your life, you may feel that, you may feel depressed later on in life. It could just be anything. It could be finances. It could be stress. It could be whatever's going on in terms of the political environment. For some people, they get depressed about that as well. So there's a lot of different things going on in terms of for depression for people.
Now, you had already kind of mentioned the symptoms. If a loved one is to see someone in their family, one of their friends, having some of those symptoms, or maybe you're feeling them yourself, what should you do? What should you do for your loved one?
So first off, it's always good to look for help. So if you have friends, if you have family that you can actually talk to, that'd be awesome. So you can just say, you know what, I'm not really feeling very well today. You know, I'm kind of feeling depressed. I can't get out of bed. I'm not being able to complete my daily activities. You know, can we talk? Just being able to be there for somebody. If that person is telling you that they're feeling depressed, the worst thing, and I hear it from all of my patients saying, get over it, it's not that bad, is probably the worst thing you could possibly say to everyone, because if they could get over it, they would get over it.
Okay.
So that's one of the worst things you could say to somebody. If someone is feeling very depressed and they're losing if they're losing a lot of weight, if they're not sleeping at all, it's not a bad thing to go to the emergency room too if they're feeling suicidal, to say, you know what, maybe get evaluated, because we don't want you to die. And you can say that to people. You could always just call your insurance company too, and they have a list of all the providers in the state. You can either do individual therapy, there's intensive outpatient programs, there's partial hospitalization programs, which aren't necessarily in the hospital, but they're all-day programs that you can attend. Psychiatry, getting medication can also help as well.
Yeah, that was going to be my next question, is that, you know, when someone does make that first step, there are different treatments that can be offered. It's not really just a, fits-all approach.
No, it's not. And that's why it's really important to go be evaluated by somebody like myself or any other clinician out there, because it's important to know what your options are. You might require individual once-a-week therapy for a half hour to an hour. You may actually require 3-day-a-week treatment. We do that. It's called an intensive outpatient program, where it's 3 to 5 days a week, and you can meet there, and you can meet and talk with a clinician in a group format. There's group therapies. There's all sorts of different treatments out there, and talk to wherever you can go, like the Bristol Hospital Counseling Center, or wherever else there is, because you might not live in the Bristol area, so it's, you don't just have to come to Bristol.
If you do happen to live in the Bristol area, or you're somewhere around here where you can easily get there, can you tell us a little bit about this event that you have coming up, and really, I guess, this series, I should say?
So We've envisioned being able to break down stigma. That's what we really want to do, because everyone maybe knows somebody or has experienced somebody or have experienced themselves with mental illness. And it's really important for people to know that it's okay to talk about it, that you don't have to hide those feelings. You don't have to hide behind that. You don't have to put yourself at risk of hurting yourself or somebody else. So being able to come and talk about that in an open forum. It's not therapy in that session. I'm not going to be giving therapy. It's going to be talking about depression, talking about symptoms, and what you can do to get some help.
Interesting. So let's put those event details up on your screen if we can let you know there. And there we go. The first one, Tuesday, August 1st, talking about depression from 6:30 to 7:30. And, you know, again, this is all free. You can go, you can ask your questions, get some answers if you have some. And then also next month, Bristol Hospital will be chatting with us right here about the next topic in that series, which you can also see, you know, suicide awareness. That's also another really big, important thing. Because like you said, you know, when in doubt, go to the emergency room, call 911, do whatever you need to do to get someone
September is Suicide Awareness Month, too. So that's why we're doing it then. So.
Well, thank you so much for being with us this morning. Appreciate it.
Thank you so much for having me.
All right. Well, coming up next, we're here on Good Day Connecticut.